Other news now coming in from the valley. A pregnant lady had to be carried for several miles to reach the district hospital in Kishtwar in Jammu because the local healthcare center in her village lacked the proper medical facilities in case of any medical emergencies. Locals have alleged that the primary healthcare center is in shambles and no female doctors are present at the center, forcing many patients to trek to the district hospital in the Kishtwar for medical care.
जनाब जो डिलीवरी वाले पेशेंट हैं हमारे तो वो हमें शिफ्ट इधर से किश्तवाड़ करनी पड़ती हैं। जब अस्पताल में आते हैं तो इधर लेडीज डॉक्टर अवेलेबल होते ही नहीं, तो इसकी वजह से हमें शिफ्ट किश्तवाड़ में करनी पड़ती है। हमें जहाँ 2000 रुपया खर्च आता है वहाँ हमें 15,000 रुपया खर्च आ जाता है।
My colleague Mir Farid now joins us live, getting us further inputs on this. Mir, the primary healthcare center is perhaps the first level of treatment before you go to the next. If the primary healthcare in this village is in shambles, how is it that the government is ready to put the lives of so many people at risk, asking them to go to the district hospital every time there is a case of emergency?
Well, you're absolutely right. This is another case that exposes the rot in the healthcare system of our state. While they do show the hunky-dory picture when it comes to the city or the towns, but when it comes to the far-flung areas like this one, now this is not even very far-flung. We're talking of Tehsil in the Kishtwar district. It's a Nali area where there is a primary healthcare center, but it is in shambles, as you rightly said. Usually there's no doctor, and even if there is a doctor, they do not care about the fact that how would they really care the pregnant ladies. There is no one to really take care of the maternity part, and that's something that has been exposed. Now in the visuals you can clearly see a pregnant lady being taken on shoulders by her relatives, not for 1 or 2 kilometers but for 10-15 kilometers just to get basic health care. Now this is something that we have in fact exposed time and again from various areas, but it seems nothing is being done to upgrade these facilities. Okay. And it is these poor people who are the worst sufferers. Now in this case, the lady was lucky that she did reach the hospital in nick of time. Had she been late by 5 or 10 minutes, anything could have happened. So this is something that should be in fact taken care of. But again, as I said, this exposes the rot in the healthcare system, and a lot more needs to be done, because here we're talking of life and death. This is no other sphere of governance. This really means that you can save or otherwise a person, and this definitely needs to be done about it. And
Absolutely.
You have the locals who are up in arms. They are now demanding that immediately steps should be taken to improve the healthcare system of the area. Back to you.
Absolutely. And is there any possibility that the government, the state government, is going to take any cognizance of the plight of these people who have to trek up to Kishtwar every single time there is a medical emergency? Can we expect the state government to act at this point?
Yes, the state government should act. In fact, this is their job. This is their responsibility. They have huge funding, not only if you talk of the state, but through various central schemes. They get a lot of funds to improve healthcare. But as we have seen, that funding or expenditure mostly is on papers. When it comes to having that really or translating that into action on the ground, absolutely there is nothing on the ground. And we've seen that if you talk of rural areas like this one, the healthcare system is in shambles, and that's something that these people want. This is their basic right, and it is being denied. Now we hope that after this, the state government will wake up from its slumber. The health department will take steps so that no one else has to really go through this ordeal the way this woman or her family have been or have gone through. Now this is in fact woken up the village as well. They want that there should be immediate action, and at least as far as the primary health care is concerned, there should be a lady doctor who should be there to look into these cases and take whenever there is an emergency, she should be there. So that is something that they want, and this is not an unjust demand. This is their basic demand, and this is something that should be provided to them as far as the state government is concerned.